Um, Hi, I'm Ezgi from the University of Sheffield. Today, I'm a PhD student and I will talk about one of my study called Family Income, Parental Distress and Child Mental Health, Examination at the Within Family Level. I'm from, by the way, I'm in Psychology department. Externalizing problems, such as conduct problems and ADHD problems, present a common and serious problem for children and their families and society. Children with externalizing problems are much likely to face future emotional, behavioral, substance abuse problems. This is shown in literature already. That's why it is critical to understand causal risk factors increasing the externalizing problems to make more effective preventive and treatment studies. One of the most prominent risk factors found in the literature is for the externalizing problems is low family income. Regarding to U.S. Census Bureau report, a significant number of children live in poor families. That's why it makes the understanding of the relationship between low family income and externalizing behaviors is critical. There are some models explaining the relations between family income and child mental health problems. And one of the most influential one is family stress model, as you can see from that side of the screen. Family stress model proposed that economic pressure, as you can hear, economic pressure contributes to parental distress, and which is in turn impacts upon marital conflicts and parenting practices, then in turn child externalizing problems. Family stress model in the literature is supported by a range of evidence. And for instance, Kiernan et al. Examined children between age 3 and 5 using the data from Millennium Cohort Study, a UK longitudinal data, and with using structural equation modeling. Results of the Kiernan showed that economic deprivation was associated with children's emotional and behavioral problems, and these were partially explained by mediating effect of maternal depression symptoms and parenting factors, which is supporting the family stress model. However, the literature examining family stress model have some methodological limitations. Studies are mostly based on cross-sectional data, and cross-sectional data is mainly assessing the variables once in a time. That's why they wouldn't able to give direction of effect to us. And so we wouldn't able to understand well whether income results or cause of the child externalizing problems. And as an alternative, longitudinal studies, especially cross-leg models offer an opportunity to investigate the direction and stability of the effects. And the literature, the only, as we are aware, the only cross-leg model applied by Petrovsky et al. With cross-leg panel model, and found that despite the bidirectional relationship between family income and conduct problems, parental distress wasn't a mediator, so it didn't supported the family stress model, although supported the bidirectional relations between income and child mental health problems. And cross-leg panel models also have some limitations also when it comes to establishing robust causal relations. In the cross-leg panel model, it assumed that individuals fluctuate around a common group mean in each variable over time, and they suggest there is no stable between person differences for people. However, in reality, average level of variable across time might differ between individuals. It means each person may have their own trait like with an individual level. For instance, each person may have different levels of narcissism. It is a trait-like properties. So that's why everyone has within individual differences regards to trait-like level. But in the cross-sec panel model, it doesn't matter. That's why approach of cross-sec panel model doesn't allow us to differentiate within individual and between individual differences from each other. So it may cause some misinterpretation of the relations. On the other hand, developmental theory mainly focuses on within individual changes. That's why understanding of the within individual and between individual differences differently is important to make a more robust conclusions. And that's why using a model differentiating within and between individual is important. And in the present study, we aim to examine family stress model with a within individual design called random intercept cross-leg panel model. And we hypothesize that family income and child externalizing behaviors are reciprocally related to each other, and parental distress mediates the relations. This is the first investigation of family stress model that focus on within family dynamics using a causally informative study design. And models are fitted separately for boys and girls, as it's possible that relationship between child and parental mental health differ by gender. We used Millennium Cohort Study, a long-term birth cohort study tracking around 19,000 children born in UK between 2000 and 2002. And we examined children from age 9 months to 14 years old. Sample size was 11,845. We used as a measures family income. Families were asked to report their total income from predefined income bands, and Millennium Cohort Study team converted banded income, these bands, into OECD equalized income. And parental distress was measured using Kessler scale with 6 items, and externalizing problems measured with strength and difficulties questionnaire, parental report. Random intercept cross-leg panel model were fitted in M+ software, and in the random intercept cross-leg panel model, by including random intercepts for each repeatedly measured variable, we would able to differentiate within person effects from between person effects. And then random intercepts are allowed to covary, and autoregressive and cross-leg effects are defined between the residuals. It is giving us to insight into within family process. And also to investigate longitudinal mediation, we incorporated second-order cross-leg effects. Here is how random intercept cross-leg panel model looks like. Here is the between part of the model. Random intercepts of the variables correlated with each other. So then we can understand, as random intercepts give us starting level of the variables, we can understand between level differences between people. And in the within individual part, cross-leg effects, autoregressive and cross-leg effects were put with residuals. That's why it's give within individual. We can understand how someone's own trait-like level differentiates from their own mean. From their own mean, how their own mean fluctuate around time. This is the results of girls. That in our results, there was no relation found between income and externalizing problems, which is different from what the literature is tell us. And maternal distress at age 11 mediated the relation between family income at age 7 and at age 14, which is supporting the family stress model. And also increased externalizing at age 7 and increased maternal distress at age 11 was associated with each other. Also, increased maternal distress at age 11 and 14, child externalizing associated with each other. Results for the boys, there was no relation between income and externalizing also. It is the same with girls. And there was no indirect relation found between income and externalizing. It didn't support the family stress model, opposed to what we have found for girls. And increased externalizing at age 7 and increased maternal distress at age 11 was associated with each other. As opposed to the literature, externalizing and income wasn't associated with each other for both genders. It was different from what the literature already tell us. However, family stress model was partially supported for girls. And one possible explanation is that why our results didn't support the literature. It would be because we use random intercept cross-leg panel model, while other studies mainly cross-sectional and traditional cross-leg panel models. As I mentioned, random intercept cross-leg panel model allow us for the differentiation between between and within individual differences each other. So it enables us to estimation of pure within person autoregressive and cross-sec effects. Maybe that would be one of the reasons why our results is different. Regards to strength and limitations, this is the first examination of family stress model with an individual design. So this is giving more deep understanding of causal relations between income externalizing and parental distress relations. And we use a large national representative sample, Millennium Cohort Study. We examine children from early childhood to late adolescence across a broad span of their developmental process. It provides a comprehensive perspective for testing this theory. However, as a limitation, as I mentioned before, family stress model include also marital conflict and parenting quality. These are the other component of family stress model, but we wouldn't able to include them because of the limitation of our data. And also, children's problem where mental health problems were primarily evaluated by their mothers, it may cause a common method variance because depressed mother may tend to more problematic their children than non-depressed parents. And as an implication, when considering the mediating effect of maternal distress in the relations, interventions aimed at reducing maternal mental health problems could potentially mitigate the influence of family income on children. And also interventions can be modified with regards to gender differences as our results different regards to gender. Thank you for listening.